Hello, everyone. This is Dr. Garcia, anatomy professor here at Texas Women's University. I'm going to go over the vertebral system. As you can see on the screen, we have the skull on top, and then we have 7 cervical vertebrae, and they are numbered from superior to inferior. So, number 1, where my cursor is, C1, C2, C3, C4, C5, C6, and then C7. C7 is pretty big, as you can see. And then we have thoracic vertebrae, and there are 12, and they start with number 1. And how do I know that's number 1 is because I see that top rib, that little rib right there articulating. So I know that's T1, T2, T3, and they're going to go all the way to T12, which is right here. And how do I know that's T12? Because I know that there are 12 pairs of ribs, 12 on the left, 12 on the right. I also know that 11 and ribs 11 and 12 are smaller, especially 12. He's very small, and he articulates. Articulates mean where two bones form a joint together, and that's called articulate. And T12 rib articulates, I'm sorry, 12th rib articulates with T12 right there. Then you will see 5 large lumbar vertebrae. L1, L2, L3, L4. L5's a little hidden. Part of the pelvis is in the way, but the very bottom lumbar vertebrae is L5. Then we have the sacrum, and it is actually 5 fused vertebrae. They are fused while we're embryos, and there are 5 levels, and that's abbreviated by S. S1, 2, 3, 4, 5. Below that, the small, very skinny coccyx, which are 4 fused vertebrae together. And those are coccyx 1, 2, 3, and 4. Very small. The layman's term for that is tailbone. But let's get a little bit closer look. Little closer look at what we have here. Yeah, there they are. There's the skull. There is C1. He has a nickname, Atlas. If you're familiar with Greek mythology, Atlas is the strong muscle man that had the globe or the world on his shoulders. Just Google that and you'll see a picture of Atlas carrying the world on his shoulders. So C1 is called the world being the skull, called nickname Atlas. Somewhat oddly shaped vertebrae. Definitely not typically shaped, but it is cervical and it's C1. And this is the back or posterior view. This is the anterior view. Notice that all 7 cervical vertebrae have this opening. A fancy term, a medical anatomy term for opening is foramen. So they have this foramen on each side. And whenever there's a foramen, something goes through it, usually an artery. Vertebral artery is going to go through there. That's C1. C2, another one oddly shaped. C1 and C2 are not typical. Notice C2 has this tall, upwardly protruding process. Process is an anatomy term for a piece of bone that's it's connected to a main bone and it sticks outward, and that's a process. And that's called the dens. Yep, the dens. And the dens, if you remember back to the atlas has this little area here, this space right here where my cursor is where the dens is. And it With the shape of this C1 or atlas keeps that den in place. And that den and Zins is very important for cervical rotation. But now we get to C3, and this guy's a little more, there we go. That's a little more straightforward. This is a posterior. This where I have my cursor is the back side. That's posterior. This is anterior, and this is lateral and lateral. Lateral means out to the side. There's that foramen again. Foramen. Now, this is a foramen too, but this is for the spinal cord. So a little bit larger, whereas these lateral ones are for that vertebral artery. But this is posterior, and that's the spinous process. Spinous process. Off to the side, off to the side here, cervical's not the best example. It's going to be more clear in the thoracic and lumbar, but the transverse process is out to the side. Cervical looks kind of odd when it comes to the transverse process. Matter of fact, when it comes to the spinous too, it's got 2 points there. That's bifid. So it's got 2 points, whereas all the other regions of the spine only have one, a single process. Also notice that this is the vertebral body. This big part right here is the vertebral body. And then this region right here is going to articulate with the bone segment above it and form a joint, which we're going to learn is very important. And then we keep going down to C4, C5. They all look the same. Let's take a peek at, what is this, C6. He looks very similar to the C3 we saw. What's this back part called? Spinous process. What's this side piece called? Transverse process. And what's this big section here? Vertebral body. Let's look at C7. Almost the same, except C7 is, if you think about it, one more vertebrae below C7 is T1, so it's a different section. So C7 here, has characteristics of the thoracic area, mostly this spinous process. Now it's single instead of split in two, instead of the bifid. So that's your clue that it is C7, the only one like that. And then they still have that transverse foramen for that vertebral artery, that hole there. And of course, the bigger hole for the spinal cord. Now we can go to thoracic spine. And this thoracic spine is very unique because it has those ribs there. So let's start with T1. There's T1. Remember, there's 12 thoracic. There, that looks a little more straightforward. There's that spinous process. They're all singles now. Look at that plain looking transverse process. It was irregular in the cervical. There's that vertebral body. Now I can tell you about 2 other regions of the vertebrae. Let me get a good orientation here. This section right here is the lamina, and it ranges from the spinous process to the transverse process. Some surgeries, they cut out that section of the bone, that lamina section, to get to either the spinal cord or the ligaments around the spinal cord or to the discs, which we're going to see in a little bit. The other section is the pedicle, which is it's a little more anterior, from the transverse process to the body, smaller section right there. That is the pedicle. What we noticed real different about the thoracic spine vertebrae is these little areas where the ribs articulate with. And then this is another area that the rib articulates with. Now, this area is where the vertebrae above it articulates with. That's called the facet joint. And notice in the thoracic spine, they are facing upward like that. And in the cervical, they had them in the cervical. I didn't talk about it, but here in the cervical, from the side view, they're slanted, whereas in the thoracic, they were facing upward. And we keep going down. We keep going down. They're pretty typical. They do change some characteristics here in the middle of the thoracic spine. We can take a look. Who's this? T7. We can see T7. He looks pretty standard. Vertebral body. The facets, they're the ones that articulate with the vertebrae above it or the vertebrae below it. There's your the spinous process. And here in the middle of the thoracic spine, T6, T7, T5, they're in the mid range of the thoracic spine. That spinous process really, you can see it dipping downward real far and real long and downward. And that's how I know this is mid thoracic spine. We're going to keep going. And then I see that little rib 11 and rib 11, rib 12. There you go. 11th rib, 12th rib, real small, real small. Kidneys are right there. Kidneys are right there. So that's all 12 does is protect kidneys a little bit and serve as attachment to some muscles like the diaphragm and the quadratus lumborum. But I find 12th rib, and then that will show me right there. Vertebral thoracic vertebrae T12. That's how I found them. And then go below that. Now we're to lumbars. We have 5 lumbar. 1, 2, 3, 4, 5. They're large. So let's take a look at one of these lumbars. Who's this guy? L2. That's him from the top view. Still similar. Vertebral body, spinous process, transverse process, one on each side. This region is the lamina. From the spinous to the transverse is the lamina. Small region behind the transverse to go into the body, pedicle. Think about a fracture that might happen in some of these areas too. And then notice there's no articulation with ribs. So remember the thoracic spine had extra areas to articulate. And look at these lumbar facets. This is the facet on the left, facet on the right, and they face a different direction. The thoracic spine was facing forward, up and down. This one is facing forward, but medially facing each other. You see how they're facing each other. So that's how I know this is lumbar. And also the side view. Remember how the thoracic spine was real skinny and long and pointing down like this? Totally different here. Still has the foramen for the spinal cord. We go all the way down to 5 right there. And then we have the sacrum. Let's take a peek at the sacrum. There we go. 5 bones that fuse together. They're all fused together, but we're going to talk about nerves later. And for each one of these levels, there's a corresponding nerve. And then the last part is the coccyx. COCCYX, coccyx. And you can see the four little sections, a real small one at the very bottom. That's your tailbone. It can get broken. You can fall on your bottom and it get knocked out of place. It can create a lot of pain.